So we're here to launch a level of care program with all of our great hospitals here in Baltimore. As many of you know, we have some of the greatest hospitals in the world, but we have an epidemic in our city, opioid addiction, overdoses in our city that we must address. And so because of the convening of this task force, we asked for recommendations in terms of things that we ought to be doing. And this group was really fully engaged in how hospitals can help us in treating addiction. And that's exactly what we're talking about here today. We have representation from Johns Hopkins, Bayview. We also have Bon Secure and the University of Maryland has also joined us as well. And so we're excited about this work because we believe that this is something that is not just true of Baltimore, but is true for our nation. And we're hoping that we're setting a precedence that other folks will understand that when we talk about drug addiction and we talk about opioid addiction, we're talking about a sickness. And when we talk about it as a sickness, that means that we should be coming up with how we are dealing with this from the hospital perspective. And so we've created this level of care program that enshrines best practices for responding to this particular epidemic, and that the public hospitals recognize how we implement this and how important this will be for the citizens of our city. The level of care allows for everyone to come together to push all of us to fight this epidemic. You've heard us talk about it. You hear about it, not just in the city of Baltimore. The governor, too, declared a state of emergency as it relates to opioid addiction in the state of Maryland. It is an epidemic throughout our nation, and it cries for us to come together and come up with real solutions to a problem that is gripping our city, our state, and our country. And so you're going to hear from Dr. Nguyen. You'll hear from Samuel Ross, Dr. Samuel Ross of Bon Secure. Renee Blanding is here from Bayview Medical Center, and I believe we're going to hear from the University of, okay. So we'll start there. Let's start with Dr. Nguyen.
Thank you very much, Madam Mayor. Thank you, Madam Mayor, and thank you for always doing what is right. I'm so proud to work for a mayor who really understands that addiction is a disease and that this is something we all have to do together. So we have many partners to thank. I'd like to thank our partners who've joined us today. First, starting with the leaders of our extraordinary hospitals. Dr. Sam Ross from Bon Secours. We've got Donna Jacobs from University of Maryland. Renee Blanding, Dr. Renee Blanding from Johns Hopkins Bayview, who we'll hear from. Nikki McCann from Johns Hopkins Hospital. Don O'Neill from St. Agnes. Dr. Stuart Levine from MedStar Harbor. Bradley Chambers from MedStar Good Samaritan and Union Memorial Hospitals. Don Hurley from Sinai. Dr. Wilma Rowe from Mercy. And I would also like to thank the Maryland Hospital Association, represented by Shamanda Braithwaite and David Simon. Thank you. Thank you also to the Mayor's Work Group on Drug Treatment Access and Neighborhood Relations, which originally recommended the initiative that brings us here today. Particularly, I'd like to acknowledge Don Fry, the president of the Greater Baltimore Committee, and Bill McCarthy, president of Catholic Charities, who were the co-chairs. Dr. Ross is actually serving double duty because he's not here only as one of our hospital leaders, but also as a member of the Mayor's Work Group as well. I want to give a shout out to my fantastic team at the Baltimore City Health Department, Evan Burrow, Special Advisor for Opioid Policy, and Dr. Shelley Chu, Senior Medical Advisor. And finally, we owe our thanks to several groups who are helping to make possible the important work that hospitals have already done to respond to the opioid epidemic. I'd like to thank the state's Behavioral Health Administration, the Mosaic Group led by Marla Oros, who is a nationally renowned expert whom Baltimore is lucky to call our own, Krista Taylor, CEO of Behavioral Health System Baltimore, and of course the hospital, doctors, nurses, social workers, and all the staff who are carrying out this work on the front lines. As Mayor Pugh said, we are in the midst of one of the deadliest drug epidemics in American history. In 2011, there were 167 overdose deaths in Baltimore. And by 2016, that number had more than quadrupled to nearly 700. One of the culprits is fentanyl, a synthetic opioid that is 50 to 100 times stronger than heroin. Since 2013, we've gone from 12 fentanyl deaths in 1 year to more than 500. There can be no question that this is an emergency and a public health crisis. Here in Baltimore, under Mayor Pugh's leadership, we have responded with the urgency that this problem demands. First, we save lives with naloxone, the antidote medication that reverses opioid overdoses. In 2015, I wrote a blanket prescription for naloxone to all city residents. We've trained more than 36,000 people to use the medication. And under the mayor's leadership, in 2 years, that means that these residents have saved over 1,900 lives of their fellow citizens here in Baltimore. Second, we expand access to treatment. We started a 24/7 mental health and addiction hotline that gets 1,000 phone calls a week. We piloted a hub-and-spoke model to expand addiction treatment to primary care settings. Mayor Pugh recently announced the start of Maryland's first stabilization center in Baltimore, which we hope is the first step to a 24/7 ER for addiction and mental health. Third, we changed the way that we talk about addiction by fighting stigma with science. As Mayor Pugh states over and over, we know that addiction is an illness, it's a disease for which treatment exists and recovery is possible. Despite this, in hospitals across America, the response to someone who needs treatment often is, we don't do that here. Overdose is the leading cause of death among Americans under 50. We don't do that here cannot be an option. We cannot stand by in the middle of an emergency when we know that treatment works and our only limitation is our ability to make treatment available. Mayor Pugh and I are proud that Baltimore is leading the nation to provide evidence-based treatment for the disease of addiction. Through the health department's convenings, with the dedicated leadership of hospitals, and the expertise of the Mosaic Group, our city's hospitals are changing the culture of medicine. Nearly all 11 of our emergency departments now offer medication-assisted treatment on demand for patients with opioid addiction. That's true of no other city in America. These ERs also employ peer recovery specialists, people in recovery from addiction, to help patients navigate the resources they need. To ensure that no patient slips through the cracks, our hospitals are screening each patient for substance use, providing any patient who screens positive with brief intervention and linkage to treatment. Make no mistake that these are extraordinary achievements, and so we stand here today to applaud our hospitals and celebrate them for stepping up and being such great partners. Today, we announce an initiative that builds on these achievements. We call this the Levels of Care for Baltimore City Hospitals Responding to the Opioid Epidemic. This is based on a similar initiative in Rhode Island, which is one of the few places in the country where overdose deaths went down last year. The levels of care articulate evidence-based best practices for treating addiction and preventing overdose, such as screening every hospital patient for addiction, offering treatment on demand for those who screen positive, helping patients at risk for overdose to get naloxone, and making sure that their doctors are prescribing opioids judiciously so that we can end the cycle of addiction and overdose deaths. There are 3 levels of care. The higher the level, the more comprehensive a hospital's response, with level 1 being the highest, and then level 2 and 3. These levels are being developed with active input from and in partnership with our hospitals. Today, we open up our proposed levels of care to public comment. We want to hear from the public, from addiction treatment providers, from community groups, and from patients and families themselves. We invite everyone to take a look at our proposed levels and weigh in through our website, which is health.baltimorecity.gov. We will read every piece of feedback and finalize the levels of care together with our hospital partners this summer. Together, under Mayor Pugh's leadership, let's build upon the work that's already being done and make Baltimore City a national model for treating addiction alongside every other disease. And it's now my pleasure to introduce a good friend and the leader of a hospital with a long history of treating addiction and preventing overdose. Dr. Sam Ross is the president and CEO of Bon Secours Baltimore Health System. He's a great resource for me and a wonderful partner for the city. And I'm so glad that Dr. Ross is not only helping us with the work group, but also has been doing tremendous work along with his hospital and all of our partners. Dr. Ross.
Thank you. Good morning. Thank you, Mayor Pugh. Thank you, Commissioner Wynn. as she stated, Bon Secours has been in the community for over 135 years. During that time in West Baltimore, we've been one of those areas that really has seen a significant increase in substance abuse issues and mental health disorders as well. And when we look at our emergency department, like most of my colleagues here, what we're seeing in our emergency rooms, oftentimes 50% or more of people who are coming in have some substance abuse and or mental health disorder as they come in seeking treatment. And it really is a medical issue that we're committed to addressing. We want to thank our partners with Mosaic and others, because with the early intervention and treatment programs, peer recovery, we've had those things in place for a number of years. And what we found is that if we're going to make a difference in the lives of those that we have been asked to serve, called to serve, we really have to meet them where they are. And if we meet them in the context of a chronic disease, like we do diabetes and congestive heart failure and lung disease and others, then we approach that differently. We look at being community responsive. And being community responsive means caring for the health of the community in what some people may view as non-traditional approaches. So whether it's the stabilization center or whether it's what's being proposed today around levels of care, while we may think of that as non-traditional for healthcare or for hospital systems, it really is where we have to be in our current world, in our current state, in order to really get the difference in health outcomes that we want for all of the people that we serve here in this city, in this state, and beyond. So we look forward to partnering around the levels of care, because it's really not just about certification. It's about how do we provide the best quality, safe, compassionate care for those in our communities that we all have been called to serve. So we look forward to working with you through these levels, making them as appropriate and accurate as we can, and really figuring out how do we better serve those that we all have a responsibility for here in this city. So thank you for allowing us to participate as a partner.
Thank you. Thank you, Dr. Lynn.
Thank you very much, Dr. Ross. And I'd like to now introduce a leader from the other side of the city, who is the leader of another hospital leading the way. Dr. Renee Blanding is the Chief Medical Officer at Johns Hopkins Bayview Medical Center. Under the leadership of Dr. Blanding and CEO Dr. Rick Bennett, Bayview has decades-long commitment for treating substance use disorder, including through their Center for Addiction and Pregnancy and through early adoption of primary care doctors treating this disease. Thank you very much, Dr. Blanding, for coming here today.
Good morning.
Good morning.
Thank you, Mayor Pugh and Dr. Wynn, for having us here this morning.
He's got a doctor.
I know. I think by the time we're done, it will be very deserving. As Dr. Wynn says, since the early 1970s, Johns Hopkins Medicine has participated in serving the opioid-dependent population. And today I wanted to highlight just a few of the accomplishments that my colleagues have actually participated in over the years. And before moving forward, though, I would like to approach this from a very personal standpoint. I'm an anesthesiologist, and never in all of my life did I ever believe that fentanyl would be killing our citizens on the street. It is a drug that is used primarily for palliative care and chronic pain, as well as in the operating room where I used it primarily. And I believe that now is the time that we actually have to work together to eradicate this scourge from our communities. So Bayview actually, since the 1970s, has had a Center for Substance Abuse and Treatment and Research. As Dr. Wynn also mentioned, we also have the Center for Addiction and Pregnancy, in which we provide addiction treatment services and residential support for our pregnant patients who have addiction issues. That has existed since 1995. Also, since 1995, we've had the comprehensive care practice, which also provides well over 8,500 outpatient visits annually to our patients who need primary medical care, as well as specialized services in addiction and Suboxone maintenance. And then we also have our addiction treatment service, which is a comprehensive program for our patients suffering from opioid use disorder, as well as those with co-occurring psychiatric illnesses. 2 years ago, Johns Hopkins Bayview actually started the implementation of the SBIRT program with staffed peer recovery counselors in the emergency department as well as on the inpatient units. And that has actually been very, very successful. The rollout of that program occurred in July of 2017, and since that time, in the first 9 months of the program, nearly 27,000 patients have been screened, and 64% of those patients have accepted brief interventions from the peer recovery counselors. And I'd also like to say that in February of this year, Johns Hopkins Bayview launched the Overdose Survival Outreach Program in the adult ED as well, again staffed by our peer recovery counselors, and they provide aggressive outreach to our patients by way of intervention and referral for our survivors. So I stand with our colleagues throughout the city and with our mayor to know that we actually have to do something collectively to solve this issue. It is a very, very concerning public health issue, and I stand committed to helping all of you and supporting this effort. So thank you so much for involving us.
Thank
It's
you.
a privilege.
I'd also like to give a shout out to our health commissioner, Dr. Nguyen, and our health department, because one of the things that Dr. Nguyen does and her department is look around the country for best practices, as well as thinking out of the box in terms of what it is we should be doing. And when you think about this level of care program, the task force and all the work that has been done, it is because we're not just looking at what's happening today, we're looking at how do we cure it, how do we solve it. And we believe that our hospitals ought to be partners in this effort. I see that Don has joined us. Dr. Nguyen gave you a shout out a little bit earlier. But it is about how we continue to work together. And we believe that our hospitals can play a really, really important role in how we wrap our arms around this addiction problem that's gripping our city. And the great thing about our hospital system is that it does reach, in many cases, throughout the state. And so we believe that we will not just have an impact on what's happening in Baltimore, that we'll have an impact in the state. And so with that, Dr. Nguyen, I'd like for you to join me as we pass out our certificates to our partners. And we want you to know that this is really, really important to us, and we take this very seriously as Dr. Nguyen takes all of our issues around health and healthcare in our city. So thank you for your work, and let's continue.